Hi there, this is Connie Welch with LifeBeyondHepatitisC.com. Well, I can't believe it's been 10 weeks since I have completed the triple therapy treatment for hepatitis C. I wanted to give you an update today of what week 10 of post-treatment is like and share with you some of the after effects of treatment and some of the side effects that have come and gone since treatment. But first, I want to give you a quick recap. First of all, I'm genotype 1. This has been my third treatment, and I feel very confident and hopeful that this is the final treatment. But I did treatment first off in 1995 with interferon, and the second time in 2000 with interferon and ribavirin. But in the 12 years since I had done treatment last, they have made tremendous improvements in how they are treating the actual virus cells. And the protease inhibitor that was approved and released in May of 2011 is the first thing that they have come up with to actually attack the virus cells themselves. It's really like a search and destroy mission for that. So this has been very successful. The treatment has been very hard and very rough, and there were some times that I wasn't sure that I was going to make it, but you know, I did, and I'm very grateful because the Lord has just walked me through this valley of darkness and just brought me out on the other side, and I have just held on. So just very, very grateful that this treatment has worked. And I began treatment this year on April of 2012. I completed treatment in the end of September, which was 24 weeks. And as of the first part of November, I had received 5 consecutive non-detected virus load counts. That's extremely good news because non-detected literally means the virus is non-detected in the body. It does not mean remission. That is completely different. The virus, the way it is calculated, the test is calculated, is that it cannot pick up anything below 43. And that's actual virus cells. That's not percentage. So this is very good news. It is very precise test that is done. And the reason why you go longer after you receive your first non-detected virus load count is this allows the medicine and the treatment to keep working to stamp out any straggler virus cells that still could be present in your body. So it's important to go longer, even though I know it's very exciting to get your first non-detected virus load count, but you've got to keep going until you reach the protocol that is best for your genotype and best for what your doctor feels that you are getting with your blood work and side effects and all those things that come together. So just very happy that treatment is over with now, and now I'm 10 weeks into post-treatment. And one of the things that I have discovered about post-treatment is that I have been gaining energy, but I have not got back quite to normal like I would have liked to have so far. But that is mostly, I guess, something that I'm dealing with because I generally have been a one-speed girl, and I'm very project-oriented, and I like to get something done and get on with the next thing in life. But, you know, I've had to really relax because treatment itself did not happen overnight. And descending down the mountain and recovery stage is not going to happen overnight as well. And I know I've talked to a lot of different people, and recovery ranges from anywhere from 3 to 6 months to a year. You know, it really depends on the patient. Not every treatment experience is the same for every patient, and recovery is not going to be the same as well. So we just have to continue to be patient in the process. These are some pretty strong drugs, and it takes a while for all of that to get out of the system, get out of the body. So even though for myself, I've been mentally so ready, but my body at times through this whole 10-week period, I have gained energy But I've kind of plateaued during this last week and felt like my energy kind of have experienced being a little bit more tired. Now, that could also be that we're in the holidays now and it's a busy time of the year, so everybody's tired this time of year uh, with all the extra running around. So that could be part of that as well. But I have noticed a few after effects of treatment, and I wanted to share those with you today. I had, for a while, had still experienced some of the joint pain, and that had disappeared for a while, but now that's kind of come back. Even though it comes and goes, it's still there with me somewhat. Now, it's nothing severe, it's very tolerable, but it's something that I have noticed that is there. So I feel like that is still part of the drugs there in my system trying to leave. The other part is that my thyroid is still off and they're having to tweak my medication. But I went into treatment with hypothyroidism. So that's one of the common side effects of treatment is for a thyroid problem to arise. So when that happens, they look at that very closely and just have to adjust with medicine. So we're doing that. The other issue is that I have noticed that I've had some changes in my eyesight. And I'm going to wait until after the first of the year to see my ophthalmologist because I feel like I need a little bit more time for my system to kind of adjust a little bit more before we start making any changes with a prescription or anything like that. So along with that, I've had kind of a back issue that had come up with a lump that had come up, but I had an MRI done on that last week, and that's something benign and something the doctor feels like it's just due to some inflammation. Right now, I'm not really taking anything for that because I really am trying to give my body a rest from taking any more medicines and things, so I can try to get as much out of my system as possible. But that's tolerable, and it's something that I feel definitely could be a side effect from treatment, and it's just going to go away in time. But pretty much, energy has been coming back, and I'm definitely feeling better. As far as the side effects that I was having on treatment, as far as the nausea or vomiting and hair loss, the sores for the skin, the itching, the mouth thrush, mouth sores, and all of the other side effects that were there, those have gone. Those have left, and my appetite is back. I'm no longer experiencing a metal aftertaste with everything. So, I'm sleeping better, things like that. So overall, things are definitely so much better and have improved tremendously from when treatment initially stopped. And I can't believe it because here at the end of just in a couple of weeks, I'm going to be actually at the 3-month mark of post-treatment. So that to me is a major mile marker. So I'm very excited about that. One of the other things I wanted to discuss with you was that don't get frustrated if you don't have the recovery that you think that you might, because sometimes we can get too caught up in our own expectations. That's what I have experienced because I have wanted something so bad in a way that when I didn't feel like I met those expectations physically, then I would get frustrated. And I have realized I just can't do that with this part of the treatment phase. Recovery is the last phase of the overall treatment process. If you followed my other videos, and you'll know that we talked about that the preparation phase is phase 1 of treatment. Then you have actual treatment itself is phase 2, and then the recovery phase is part 3 of treatment. So just be patient in the process and hang in there. And I would just strongly encourage you to seek support. And if that is with your church and with friends, family, let others in on what you're experiencing. And please have good communication with your doctors and nurses and friends and family, because it's very, very important. I wanted to share something very personal and very touching that happened at Thanksgiving. We have a tradition in our family that we go around and share one thing that we're all thankful for the year. And this year, my husband leaned over to me and he said that he was so thankful to God because this meant the treatment was over and had been successful, and that he and I can grow old together. And, that's very sweet to me because 20 years ago, when I had been diagnosed with the stage that I was in at the time with my liver, they had told me that I might not have 20 years. So here I am at 20 years, and now I've gotten my life back. So, I'm just very excited and very, very, very much full of praise and thankful to God that we have come through this and that He has just held on to me every step of the way. So that's about it for Week 10 update, and stay tuned. Hope you'll come and visit the website, lifebeyondhepatitis.com. We are currently featuring other Hep C warriors as well. We are all in this together. So hope you will come by and see some of their treatment experiences and share some things. And if you have any questions, feel free to ask. If you would like to contact me even for prayer, I'd be honored to pray for you and your family. The website is full of different variety of resources, from medical information that has references to Christian devotionals that I have written primarily for Hep C warriors and their families and people who are in chronic illness. There's also scriptures to encourage you, Christian videos, but just a wide variety of treatment videos and resources on there to help you and encourage you. So please feel free to contact me, and I'd be happy to help in any way I can. Look forward to talking with you soon, and God bless. Bye-bye.